So thank you everyone joining today's webinar. Just a reminder to keep your camera and your microphone off, please. And my name is Charlie Wilbridge and I work for the National LGBTI Health Alliance, and my pronouns are they and them. Before we begin, I'd like to acknowledge the traditional owners of the land where we're all meeting from across the country. This is stolen land that was never ceded. I would like to pay my respects to elders, past, present and emerging, and any Aboriginal and Torres Strait Islander folk watching this webinar today. I also want to acknowledge the continued connections to culture, land, waterways and community. So October is Mental Health Month, and we're asking folks to focus on things to look after their mental health, but more importantly, reaching out to support others to look after their mental health. In doing that, over the past 2 years, a few LGBTI organisations, primary health networks and the Alliance have been working closely with Living Works Australia to co-design an LGBTI adaptation of their ASIST and Safe Talk trainings. Now, these trainings aim to give anyone in our communities the skills, confidence to ask someone if they're thinking about suicide and what to do next. So this work is currently happening all around the country, and today we will hear from folks who are doing this work within 2010, including DRCS. Fortunately, securing some funding has made this possible for them. Again, if you have any questions, please pop them in the chat box. And I'd now like to introduce you to today's speakers, Fee, Claire and Michelle. Welcome.
Hello.
Hello. Well, I will begin, and I will say thank you so much for that introduction, Charlie. It's a real honour to be with you today. My name is Claire, my pronouns are she and her, and I am in learning and development at 2010. So I've been tasked with the kind of, beginning. And to begin, I'd really like to acknowledge country, and I'd like to acknowledge that the land that I'm on is Wongal land, part of the Eora Nation, and pay my respects to elders past, present and emerging, and extend my respects to the communities and country from all the places that we are all on today. So it's great to be here. I'm stoked to be with my colleagues. I can see your faces and no one else's, so that's wonderful. It's just like we're having a dialogue, the three of us. But what we're going to do today is chat to you and hopefully dialogue with you through the chat function of Zoom around, I guess, these questions of, the premise is we can all respond to suicide, implementing training specifically within LGBTIQA+ communities. So that's kind of what we want to speak to. But just a bit of context, Charlie's already provided a little bit of context, but there's three of us and there's no PowerPoint and we're already a bit loose, or I'm definitely a bit loose. And so what are we, who are we and what are we doing? So I might throw it to my wonderful co-panelists to introduce themselves if you just want to kind of say who you are and your pronouns and why you're in the Zoom room. That would be awesome.
I'll jump in. Yep. Hello, I'm Fee Pascalich. Pronouns are they, them, or she, her. I work at 2010. I'm volunteer coordinator here. I also do a lot of work on the QLife program with the New South Wales partner for QLife. And I do some community education and training with Claire. And I'm zooming in from Gadigal country, the Eora Nation, here in this place that is now called Sydney. Pay my respects to elders past, present and emerging, and welcome I'll say pay my respects to any Aboriginal and Torres Strait Islander that we have with us today. Michelle. You're muted, Michelle.
You're on mute. It happened.
Okay, there you go. All right, sorry. Charlie had me muted. That's great. I'm Michelle Parker, pronouns she, her, and today I'd really like to acknowledge the Dharawal people as the traditional custodians of lands I'm sitting on today of the Eora Nation, and to pay my respects to anybody who's joining us here. I think we can't talk about suicide without acknowledging the depth of knowledge, experience, and also how people keep each other safe in Aboriginal and Torres Strait Islander communities. And so I'd really like to acknowledge that today as well. What do I do? I'm the clinical supervisor for QLife New South Wales. I'm an ASIST trainer, and that kind of happens here with 2010, also with Living Works, and more significantly over the last 15 years with Anglicare NT, separately incorporated than the crew in Sydney. And And so, you know, today a lot of the stuff we'll talk about will certainly be about a bunch of those experiences, and certainly it's been AIMA Guarantee that's supported my involvement with Living Works and the LGBTQI overlay. So I just wanted to acknowledge that crew there.
Good one. Thank you. And I'd like to introduce 2010. So 2010 is based in New South Wales, incorporating gay and lesbian counselling service, and work with young people aged 12 to 25 in a whole range of youth spaces, including housing, mental health, counselling and social support. But we're also the New South Wales state partner for QLife, which is our free national and peer-based all ages LGBTIQA+ phone and web support service. So we also do work in this space, in this community suicide prevention space, as well as delivering a whole range of inclusivity workshops, advocacy and kind of consultation. So it's a real honour for us to be in this room with so many esteemed folk from our communities, our collaborators, our partners, and you know, all of the people who continue to do this work and have done this work that lead us to this place where we can be here to have this conversation. So it's really exciting. That's a lot of intros, so let's get cracking. What we wanted to, when we got the invitation from Charlie to speak, I guess, around this question, it was kind of around the time of, you know, Mental Health Month and World Suicide Prevention Day. And, you know, really, we've been starting to deliver some of these ASIST suicide intervention training programs and trying to build this work. But that exists inside a whole kind of a context of work that many folk in the room have also been part of doing, which is about thinking around the models that we have, working on the adaptation for an LGBTI version of ASIST, you know, but also building our own literacies around how to talk about suicide and suicide safer communities. And so I really want to acknowledge the breadth of knowledge that brings us to this moment and allows us to ask the question and pose the questions around what it means for us, me, Fee, Michelle, all of us, to do this work for our own communities at this time. And so, you know, we want to just dialogue around that question and that kind of that space. And, you know, that's a real invitation to use the chat to pose questions, to offer parts into the conversation. Because really this is a question that we all face as people who work in the LGBTIQA+ community sector. Many of us who are LGBTIQA+ folk ourselves, what does it mean for us to do this work and to build the capacity of all of us to hold ourselves? So what we're going to say is, why is it important? Why is it important for us to do it for ourselves? And what's it like to be a trainer in this space? And that's kind of where we have an incredible opportunity to dialogue with Michelle, who has been practicing in this space for a long time and is, I guess, our supervising trainer. So Fee and I are kind of on our P plates. I'm sorry to name that for you, Fee, as well, but I've definitely on my P plates. And so it's a great chance to reflect on what it means to step into this space as a trainer. So let's go. Question number one is, Fee and Michelle, please speak to what is it, why is it important to talk about this idea of suicide safer communities? So very much in the kind of, in this prevention, intervention, postvention space, we talk about suicide safer communities. So why is that important, and what does that mean for all of us? Michelle, would you like to begin?
Yeah, sure. Thanks, Claire. I think, you know, look, within our communities and also external to our communities, we know, we all know a lot of people who have died by suicide, and I think it's a big conversation, and it's a really important conversation that we have. And, you know, we know people who've died, but we also know people who have attempted suicide, and we're also involved in safety plans for many people that we care for and love. And I think it's really important that as as communities, as LGBTQI+ brother, boy and sister girl communities, it's really important that we're able to sort of have some conversations about how to be there and acknowledge that a lot of people are already doing a lot of amazing work and amazing, giving a lot of themselves to keep people safe from suicide all the time. And, you know, like, it's kind of, I think that we don't particularly have many ways modeled to us around how to talk about suicide. And so, you know, we often kind of either bunker down and don't talk about it, or we hold it really tight. And then at some point, obviously, you know, it has to explode or come out in some way, which is not healthy for anybody. So I think this is, you know, it's talking about suicide safer communities is about our collective mental health, and it's also about our individual, you know, well-being. And I can't talk to Aboriginal and Torres Strait Islander people's social and emotional well-being. That's you know, like, but it's, I think for all of us, it's really important that we're thinking about this as a bigger conversation that we all should be able to have all the time. It's certainly a conversation stopper when you say, you know, we work in suicide prevention or intervention, but we don't want it to be like that. You know, we should be able to talk about this more easily, and we should be able to have conversations about suicide and think about ways to keep each other and ourselves safe as well in amongst that.
Absolutely. Yeah, like it really is. It's still something that's a big deal and a big thing to talk about, and it is a big deal. But unfortunately, mainstream responses haven't necessarily met the needs of some of the folks who really need their needs met, including our communities, including First Nations communities, including a whole bunch of other communities as well. I've certainly, having a look around, until very recently, a lot of the mainstream responses were largely following the medical model, very focused on white communities, the kind of dominant male masculine approaches to stuff that we've all experienced. Often very individual focused, the kind of professional person and the patient, very much led by a kind of checklist risk assessment stuff in spaces that maybe just are not accessible for people who are not comfortable to be in. Hospitals, clinic spaces, really set programs, and funding models have tended to preference those kinds of things, which is fair enough, and it works for a lot of people, but for sometimes it doesn't work for some people, which is really where we come in. So we at 2010 at QLife, and also at a whole pile of other organisations, and a whole lot of individuals sitting out there in the community in unpaid spaces, in community spaces, peers are already doing this suicide work. We're already working to prevent suicide. We're already working to do suicide first aid with each other. We're already working to support people after attempts or after people have died. But until quite recently, we haven't been recognised that we're doing that work. So I'm really keen to see this shift and repositioning the focus to build suicide safer communities and put it back in the communities. For me, is that word. It sits in the community. It's not easily defined as that person has suicide thoughts of suicide thoughts and I don't. It's we're in a community, and maybe one day I would, or another person I care about would. Many of us already have. So it's about our communities, which is where I kind of like ASIST, because it's not about training up professionals in a particular model. It can really fit into a whole range of different settings. It is for everyone. It's really pitched for anyone in anywhere who wants to learn more about suicide and how to keep people safer. Can't always keep people completely safe, but keeping them safer and safer now. And just pick up something, I'm not sure if it was in the intro, but it's always important to look after yourself as much as you're looking after other people. We certainly, especially talking around suicide, we want to give and give and give, but you need to also look after yourself and seek those supports. So we'll definitely include links at the end of the webinar and on the website. Folks from out the community can call QLife every evening. Yeah, so look after yourself through this today and also afterwards as well. Thanks, Claire.
Cool. That is the only things that I guess I'd like to add before we kind of segue into not just suicide safer communities, but why us to do this work, is that really what I like about this framing is that it has this kind of it's this broad focus on prevention, intervention, and postvention or bereavement. And so really framing this work is understanding that whole ecosystem and understanding that we all play a part within doing this work, be it in the policy or legislation space, be it in funding or developing new strategies or revising strategies that have existed already. You know, it's in that kind of that data advocacy stuff. It's in, you know, the skills that we all build across our lives, that life work of understanding and conversing and having conversations. You know, it's really kind of focusing on fundamental and structural oppression, as well as building our own literacies to challenge stigma in a whole range of contexts of our lives. So I really that to me is all of the work that is kind of practicing suicide safer communities, is kind of all the bits inside our structures of our organisations at institutional levels. It's interpersonally, and it's really kind of that internal work as well, because that's definitely part of all the work that we do. So, you know, taking an intersectional approach, I think, is really important, and, you know, and understanding that this is so, you know, often within kind of the training models that I've seen, there's this kind of, this idea that, you know, we talk about suicide doesn't discriminate, and that anyone could have an experience or might have thoughts of suicide. And that whilst that is true and is definitely often felt as an extremely individual experience, I like the way we talk about suicide safer communities is focusing on the community and focusing on the ways that this is structural, and yet the needs of communities within LGBTIQA plus communities will be diverse and different. And that's also part of I guess a culturally, you know, sensitive response is to be specific to specific needs. So I guess kind of moving into this next piece, Fee, you kind of mentioned that we know that a lot of people within our own communities will kind of speak to peer organisations or to, I guess, their friends, you know, or people in their lives more so or earlier than maybe going to see a GP or accessing psychological support. And so given that, we're really kind of wanting to situate this work in us doing it for ourselves. And so I guess the next question that is really important, and I think definitely been a very powerful part of my experience of doing this work, is like feeling myself to be a peer and yet also entrusted to be a trainer, and how that different that can be from other types of training delivery work that I'm part of and other parts of the work that we do. So Michelle and Fee, maybe Fee, you'd like to go first this time. Can you, I guess, speak to that question of why is this important for us to do for our own communities?
Yeah, kind of, I feel that this is kind of circular and building a bigger picture. We know that our folks in our communities are much more likely than the general population to be thinking of suicide, to attempt suicide, and to die by suicide. Which is that kind of holding that tension between going, yeah, it is individual. Anyone could be at risk of this at any time. And while also going, and there's also a higher prevalence. So everyone in our communities is probably more likely to have known someone to have thought of suicide or to have died by suicide. Stats suggest maybe at least 6 times as likely as the mainstream population, much higher in certain groups. To be thinking about or attempting suicide. And then you look at the way our communities are built, where we're brought together by some commonality around our experiences or our identities or our bodies or our relationships or how we move through the world and how the world, coming from those systems of oppression or of stereotypes, kind of place us together in this big lump of a communities. That's a protective thing as well as a risk. So like we've got heaps of people that we're really close to in really small communities. So if something happens in that small community, it can have a really big knock-on effect. So for me, it's important to do this work in these community spaces and communities that I belong to and that folks I care about belong to, and the spaces that I work, because that's where often the first response is happening. We're more likely to seek support from our peers. We're more likely to be in a space where the first person this person is told about something, and we may not necessarily have those skills innately. We care, we have those human kind of compassion spaces, but we don't necessarily have a framework to follow or something in the back of your head to go, I know how to respond to this. While also, you know, not being in communities that have suffered stigma already, and then you're talking about suicide, which has another weight attached to it. So for me, it's really important to get our communities skilled up and feeling a bit more confident to be able to respond, whether it's through ASIST or the other different suicide alertness training programs we do. I know Eda had a question in chat earlier about community responses as well. For me, I think suicide prevention is really so many of the things that we do in the community. Like 2010 provides a lot of support for homeless young people or young people at risk of homelessness. That's suicide prevention. Providing any kind of mental health support is suicide prevention. Providing spaces for people to meet and connect is suicide prevention, because we're building up that community put some skills in there as well in terms of how to respond. That's building that picture. Michelle, have you got more on this? You're muted.
Okay, sorry. So, I think just adding to that, Fee, when we see the stats, we talk about the people who have died. And so, in our communities we're often hearing about, as you're saying, 6 times more likely, and then we're hearing about the numbers of people with thoughts of suicide, but we're often not hearing about there's not really a way to measure how many people have we stopped from dying, how many people have we supported with their thoughts of suicide. And so, I think when we get together as a community and when we're thinking about training in this space or even conversations in this space as a community, it's an opening for us to recognise that a lot of that work is already being done, and it's also an opportunity for us to, we remember the people that we've lost. And I think, every time we train, there are particular people who are with us in some way, whether that's in informing our stories or, whether it's about our own lived experience, either as people with thoughts of suicide or as people, as carers, as partners, as people who are supporting other people in the community. And I think as we start talking about our experiences of suicide, and as we start talking about and acknowledging kind of what's led us to even have an interest in this space and want to have these conversations, then a lot of healing can happen in amongst that space as well for us. So I think and it's about safety then in that space too. And so I think even to answer Edda's question about, prevention and things that address collective mental health of our communities, we're addressing the collective mental health of our communities when we're actually together and having these conversations, because we're really thinking about each other in amongst that space. And that's, this is, I guess I'm talking about in the context of training, but it's not only in the context of that particular workshop, it's the things that go on outside of that and the conversations that happen outside of that. And there's something about being vulnerable together in our conversations that I think makes, it kind of improves our own mental health, whether that's about finding the people who we know we can talk to about suicide, or whether it's about finding, improving and increasing the networks of people who are able to support people with thoughts of suicide. I think that anything we're doing together strengthens our mental health together when we're talking about it. So, that's not, and, we'll talk to policy later in the kind of conversation, I think, but because that's a much bigger thing. But I guess, as Fee was saying, just wanting to reiterate that doing ASIST is not just about, you don't have to be a professional to do that. You don't have to be a professional to talk about suicide or respond to suicide. And I think, or respond to someone's thoughts of suicide. And I think that's really important. And we're quite intentional in the way we put safety around people and safety around our conversations, so that we can really have some respectful discussion and dialogue about what each and every one of us might need in that space, without it being completely a therapeutic space, because it's not that, but it's still a really respectful space, and it's a really important place to sit, because we often don't just sit there and talk about suicide. It's, it's over there. So it really gives value to the importance of that conversation.
Yeah. I would add that one thing that's been really interesting about learning the Living Works methodology around delivering ASIST, and also some of the other programs in the, I guess, offerings or packages, is thinking about the ways that, the conversations around our communities, people are coming because we all need more tools. We really are recognizing the kind of the gaps or the enormity of tasks ahead, and how significant it feels when we lose somebody, or we imagine losing somebody, or we kind of work with those and live with those and love those who have thoughts of suicide, or might experience chronic suicidality as well. And so when we do that work, I guess always thinking about the structures and the limits of the structures, and how systems of oppression operate. I personally can find it really challenging to find the answers to how, to why, and I think now, having spent a little bit of time in some of these ASIST processes, including the incredible opportunity to be in Victoria and to meet some of our colleagues and folks who are on this call through when we did the Train the Trainer for ASIST and the LGBTI adaptation work, was thinking about the tension of this conversation between the structures and the individual. And so one thing, like, how do we just learn the tools, because all we want to do is talk about how intense everything is and the limits of our systems and the structures of oppression and what we can do about that, or how we want to challenge that, or our experiences within that. And so what I have really enjoyed about the assisted spaces I've been in is that those two conversations don't have to be opposed, but they can be held together. And so whilst, any part of this prevention, intervention, postvention work is really significant, I guess it's also realizing the limitations of individual parts, but kind of where building tools into our toolkit is really also just about opening up the conversation and making space to sit and to talk and to meet folk and to begin to say, yes, this is great, and then what next, and I hope we can talk about that a little bit more as we go forward. So I guess we're kind of segueing now, or I think I've already started to do that a little bit, into what it means for us as trainers and what it means to what lessons I guess we've learned or reflections about doing this work as trainers. And this is a really incredible opportunity, I guess, to very publicly do critical reflection, between Michelle and Fee and myself as a group who are kind of navigating this this journey of becoming trainers together. Michelle, I guess I would like to kind of open to you and for you to reflect on, having done this work for some time, what have you observed, what kind of has shifted over time, and what does it mean for you to do this LGBTI kind of adaptation bit as well?
There's a lot in there.
I know, sorry.
That's great. It's great. Look, it's been, it's really beautiful to be working in community, and I think that's, I do feel incredibly honoured to be around people who want to talk about suicide as well, and even though people come with a level of anxiety around what we might be going to talk about, and I think that's really, really understandable. Like, we don't sit down for 2 days and talk about suicide. Like, we just don't do it unless we're going to a conference or something like that, and we don't actually sit in a space just with people and do that. So, I think for me it's always really important that that we also take good care of ourselves, because there's often stories, often really personal experiences that kind of come into the room, and I think that is, I think, that's obviously, if we're not traveling in a great way for whatever reasons, then I think it's really important that we kind of put the brakes on as well and look after ourselves in amongst that. And certainly with colleagues over the years, that's been a really important thing to be able to do, to be able to go, hey, I'm not going to be doing this for the next couple of months, and that's, and that's all right. So I think that's been really important to think about. And I guess I really started in this space, I think I attended my first ASIST workshop in 2004, and then did the training in 2005, and that was in the NT. And so lots of that work was really in Aboriginal communities in the Northern Territory, where there'd been a lot of loss by suicide. And I guess, although in a lot of communities there's a lot of other things that need to be put around, this isn't the be all and end all. We're talking about a skill set and being able to talk about particular skills. But what really struck me though in any of the conversations that we had, and we would always talk, and we still always talk about what amazing things people are really doing to keep people safe from suicide, but the depth of experience in terms of everybody's first-hand experience of suicide, whether it's somebody who's died or supporting someone with current thoughts or their own thoughts. And so I think that was my beginnings in terms of how we were talking about ASIST. And then when I first started delivering in New South Wales, I must admit I was a little bit like, what? You talk to people and it was very professional, separate, very boundary to kind of, no, we're not talking about anything personal here. So kind of coming back into LGBTQI+ communities and having those conversations within our communities has been has been really refreshing in a way, but also very sad in other ways. But it's a beautiful space to be able to sit. And I know it's weird to say it's a beautiful space, but I think it's really beautiful when we can actually hold the space for those conversations and for that to be okay. And that's the things that I think is quite a a lovely part of ASIST, but also something that we can do well as communities, if that makes sense. And I just saw that Amy had a question about the adaptation. Do you want me to answer that now?
Right.
So, because for people who don't know ASIST, this won't mean anything, I guess, but but it has been really important. And look, over the years, there's been a lot of conversations about what else needs to be done with ASIST in an Australian context, in Aboriginal and Torres Strait Islander communities, and that's been a separate project. And there's been a lot of other work done there with Queensland University and Amicare NT and some other crew around that. But certainly making sure that language used is relevant, that the videos used are more relevant to our communities, that any of the resourcing is more relevant. And so there's been some, I think it's still an ongoing process, and I don't think that that we need to stop it there in terms of going, oh no, that's all we're doing, because that's the pretty stuff that sits around the outside. I think there's still a bit more work to be done around what needs to change and what doesn't need to change. And I guess the thing that I really like about ASIST, and I've used the model too many times to, I guess more times than I wish I had to, but at the same time I'm glad I've had those skills to use, is that the bits that I add to it as an individual, like I have those skills now and I can go, all right, I know what to think about. And those skills are really based on what that person with thoughts of suicide needs at the time. So it's about me really gearing into that. So if I gear into that and go, right, what does this person need from me right now, and roll with that, then the other bits I put around are about other levels of safety. So yeah, and I think I might be going into your other question. Is that the thing? No? Yeah, so I think it's just important to remember that it's a part of a bunch of other things. This is not the just do ASIST and that's your answer to suicide in LGBTIQA plus communities, because it's not. It's suicide first aid, which is fantastic that we've got those skills and that we can share those skills and anyone can do this. But then what we do with it is that we then use it in ways that work for the people that need it. So, it's about using it with interpreters, and I've used this with interpreters. I've sat down with families and supported the family to ask the questions. It's been the Christmas dinner table and I've said it across the table. I've been sitting at a restaurant and gone, holy crap, man, this person needs me to ask this. So, there's this sort of, I think that there's a genuineness to the model that we can use, but the other stuff that we put around it, such as the adaptations, and I've only touched on what those adaptations are, I guess, for Amy, but that is you can do that stuff yourself as well. You can add to that. Sorry, big question there.
I know, that was amazing. Thank you, Michelle. We might go to Fee now, and then I've got another question for you, Michelle, just to come back. But Fee, take it away.
Yeah, I was thinking a bit about the adaptation. There's certainly there's a document that's going around to all ASIST trainers that has a pile of different things to weave through the way that ASIST is delivered. That's the adaptation per se. But I think for me, the real work was by the folks who fed into that. So actual LGBTIQA folks who were putting their time and experience into what we saw as what being needed in the space. I like, Michelle, your comment about coming back into a space that's very boundaried and we don't talk about it. That's kind of picking up some of that sort of medical model, kind of like this is a box that we put everyone into, as opposed to going, we're humans that have stuff. And we're within the LGBTI communities, and we can sitting in the training myself as a learner, going, that thing just doesn't feel right, and that thing doesn't feel right, and feeding those didn't feel rights back. And also now sitting in the space as a trainer, I can do the things to make those things feel a bit better. So the way that we introduce ourselves, or the space that we're given to be able to define who we are in the space and what we want to share. I think for me is the real key for the adaptation. So sometimes I see things in the community that are LGBTIQA tailored but they're not necessarily delivered by people from our communities. So someone's gone and done a piece of training and then they've tailored their work, which is awesome and great, and we absolutely need allies to do this. But it's not the same, and it is never going to be the same as someone from the community with the lived experience sitting there. Similarly with other communities with other experiences, you need that lived experience in the room to understand some of even where to start. And that's not to say that I will understand everything about every end of the LGBTIQA communities and spectrums and experiences, because I can't. I've experienced a few of those different letters, if you like. But at least I know enough about what I don't know, and I know how to create a space to let that difference and experience and complexity and beauty come out to then do the work in that space.
Can I just, one thing that, if I reflect on myself as a trainer in this work, but also across broader LGBTIQA plus inclusivity work, is what are the material differences that I've found in doing this kind of these dialogues and this training, is that peer thing feels so real. You know, you're co-facilitating, you are being asked to bring your own experiences into the room, you are being asked to share your own stories of learnings that you've had from like experiences of suicide, and what knowledge you have as a result of those experiences. And so that kind of, you know, that it's, you know, I think that like there's that kind of spectrum between facilitation and training. I feel like what we're doing feels far, even though the materials that we have to work from are so incredible and have such a rigor and a methodology, what that looks like in practice is actually far more about facilitation. And yes, there's a training of a model, but the bits that I feel are really rich are where there's actually just open space for people to share their own experiences and to connect to their own values and then practice. And that, I think, is some really powerful parts of, I guess, the principles of adult learning. But for me as a trainer, where that feels really wonderful, and I feel like I can have great impact, is because I feel my power relationship feels slightly different to folk in the room. Of course, there's still a power dynamic because I'm tasked with being a trainer, but it's different from kind of coming into spaces where there's a lot of well-meaning people who want to do inclusivity training because they've recognized gaps, they want to grow their allyship practice, they want to think about and work with LGBTIQA+ communities or respond better to the communities that already exist inside their services. But there's still this kind of, sometimes that when your identity is bound up with being that inclusivity guy, is that, yeah, you know, like you can here's some things to do, you know, let's think about language, let's do all that stuff, and that's really important, and I really value that. But I think it's often, my experience of it is often that I'm solo and that I'm quite, I feel othered in that. And even when I try to feel empowered and like I'm doing that work as a really strong ally, as a really, and I can be quite forceful sometimes in the ways that I ask folk to step into those inclusive spaces. Some of it doesn't feel like it's the principles of affirmative practice that I really, I guess, am guided by. And that's where I think that us doing this work is really more on that affirmative practice, you know, like it's the making the space for broader conversations for people, for themselves. So that was long, but I guess connected to that, I have one question for Michelle and then a little bit more about what's it like for you in the space. But I wondered, Michelle, if you could reflect on having done these ASIST workshops with LGBTIQA+ communities, like the work we've done together at 2010, and the first workshops that we delivered were for staff, volunteers, people on the board, you know, and that's a practice that many organisations I know like are wanting to kind of offer to all their volunteers. I know some already, but how that's different to being in a room which is not always all LGBTIQA+ folk from the community themselves.
For me, it's certainly a sense of safety, and I think a little bit in terms of what, you know, I think about what you were talking about earlier, Claire, when you were touching on, you know, that sense of responsibility as well in there, more as a peer. And I think, you know, I certainly feel like I have a greater responsibility to our communities when we're doing that, when we're doing those workshops. But there was also this, there was a really special sense of I think it was a hopefulness that was in there that, and there often is a hopefulness in ASIST. We often, you know, we feel great at the end and there's all that kind of stuff and it's a bit hard to talk about, but it was a sense of hope and a bit of that connection that felt like we were able to keep an eye out on each other a bit more, and just that other people who may not have been very well connected prior to that workshop seemed to be more connected by the end. And so I think that's a really important thing. And certainly for me, it felt like we were, you know, people could sit with the knowledge and learn the things they were learning without having to worry about were they going to be othered or were they going to be, you know, misgendered or anything else in that space. So I think taking away that and creating that safety was just a little bit of a, whew, we can talk about this and we can talk about what's happening in our communities, because there are some really specific things that happen around suicide and discrimination. And I think that that's a really important space to sit and an important thing to be able to do together. And yeah, anyway, sorry, round and about.
That's awesome, thank you. And Fee, is there anything else you wanted to add about what it's like as a heap leader? You know, what is it like to do this training in this space?
Yeah, I mean, I think we've picked up on a lot of it already, but really that the experience of feeling the difference between being in a space that was all people from our communities versus the times where I've gone in and it's been a mixed group. And that's always going to be, you do training for a population, LGBTIQA training, you'll get some folks who work in the space and folks who live in the space. There will be a bit of that push-pull, but just feeling viscerally the amount of experience and knowledge and stories held in the room was initially quite overwhelming. I think when I first started and going, wow, this is real. Like all the stuff I read about and write about and go, yes, we have high rates and do all these things. I'm sitting in here and all the people that are with us, like, as Michelle said, there's always people that you remember. And that's been a beautiful thing for me. Initially it was overwhelming, but it's actually brought me strength and a motivation to go, hey, we have learned so much stuff and we do have all of this knowledge as a community, and here is one avenue I can use to beef up the kind of capacity of our communities to do this work. And also the sense of time, I think we touched on as well, the fact that ASIST in particular is 2 full days. You so rarely get 2 full days to do anything on any level. So 2 full days to actually sit in a space that is deliberately created as a space you can come and talk about suicide with people from communities of your own community or people adjacent to that. It slows down that panic or the urgency that often comes up when we think about suicide. There's often this kind of, oh, someone's just told me that they want to die. I've got to fix it right now. I've got to drag them to safety. I've got to do these things, as opposed to slowing it down and actually sitting with that person or sitting in that space. So the way that the training unfolds mimics kind of what we'd like to be able to do more in the community. Slow it down. Acknowledge and recognize that there is such stigma and there is such grief and there is such big stuff, heaviness, and also find those little rays of hope and build those up and find that counter story, which is what we then take to the community and be able to do this work. So yeah, it's been a real deepening, I think, of my own experience and a real hopefulness and a real I've got great hope that we can actually do this work together as a community, set of communities.
Cool, thank you. Shout out to Anna, hi, who's just made an incredible comment. And also everyone, thank you so much for the contributions. Again, I wish this was a dialogue and, you know, imagine the richness of our conversation that no doubt will unfold in lots of different contexts. And it's just made a really great point about some of the limits of the ASIST model and experiences around those that may have thoughts of suicide daily, that kind of chronic suicidality, and what happens when someone is doing an intervention but also grappling with suicidality themselves. And I wonder, I wanted to speak a little bit about some of the limitations I feel in doing this work, and one of them, I guess, is, you know, I feel often not just in our community work, but in being, I guess, an activist in the world and someone who wishes to engage in social justice and social change making in a whole range of contexts, I get stuck between this hope and despair, you know, this kind of, yeah, and often sometimes I feel like all the articles we read have this like excellent kind of critique and analysis and challenge, and then there needs to be this kind of obligatory like hope paragraph at the end. And I feel that sometimes I feel that tension in ASIST as well, where we're kind of talking about part of the model is really looking for spaces of hope, and that hope, if we zoom out structurally, sometimes it can be really hard to hold hope really fully. So I totally recognise that that question of yours, Anna, and don't know how much to say, except that I guess what I try and do is always like find the places where you know, as small as it is, there's something to hold on to, and to reckon that we're bound up in something together, you know, so that any hope that I have, I hope to bind into with others. But I want to, Michelle, do you have any kind of comments on that question as well? Because it's so great. It's really...
Yeah, it's big. And look, chronic suicidality comes up in lots of ASIST conversations, I think. And I mean, it certainly has in our 2010 ones. And I think it's one of those things that within our communities, often the people who are asking those conversations are already there as a part of that support network, as a part of that safety plan for that person, or for people, or for a bunch of people. And often dealing with, as you're saying, dealing with own thoughts of suicide in amongst that, and how to grapple with that. And, you know, like if we just chunk it down to go, what is the little bit we can do right now? What's this little bit we can do to get this person through? And is there something else that we can hold on to in terms of the safety plan, in terms of what that person already has in place and how we can come back to that? Then we can still talk to that in a way of when we're talking about ASIST, you know, like so that it's, you know, and we can still respectfully talk about that in that context. So, you know, I think although sometimes we get caught up on the ASIST model and the rigidity of the ASIST model, but there's so much that sits outside of that, and we need to remember the limitations of ASIST. As Claire's saying, it's suicide first aid, but as you're saying, it's in a particular context. But that doesn't mean that we can't also talk about chronic suicidality and what might work in that context. Or we go, great, we can't get beyond this version of that, or, you know, we can't talk about it anymore in this context because we've run out of time, but let's have a bigger conversation about that. I think chronic suicidality and responding to that is something bigger as well, in terms of how we make sure we have ways to respond to that as communities. And I think it's really important that we keep talking about it. Yeah, and keep talking about the limitations of ASIST. There was another question before, Claire, as well, from somebody back up a little bit further. Did you catch that one? Oh, Sarah, I think that I was just thinking in terms of Sarah saying that they'd been to an ASIST and there was not any content around LGBTQI plus folk. And I guess just remembering that Living Works as the organisation, they're also doing a bunch of work as well, and now wanting all trainers to make sure they've done some inclusive practice training as well, so that there's a whole other process going on outside of us and outside of this specific work as well. So that doesn't mean it's going to be with communities necessarily, but there's, just so that you know, I guess, that there is a bit of other work going on too.
Yeah. I feel mindful of the richness in the room, and if anyone in the chat wants to offer any kind of contributions into the dialogue, maybe you know, questions or comments to add to the richness of this. And in that process, I guess it would be good for us to honour our time boundary and kind of move into that bit of like, what next? What are the gaps? And where to from here? So I guess kind of as that invitation to everyone in the room, if you do want to kind of offer a question or something, get typing. But can I throw to Fee or Michelle, are there any things that you kind of want to offer in closing or in what's next, or, you know, what's next? Fee?
So in very practical terms, what's next for 2010? We've got a bunch of delivery coming up. So we're running a couple of mind outs later this year for community. The dates have just gone up online on our website, and we will chuck the link up soon. I'll see if I can pop it into the chat now. We're also going to be running Safe Talk, which is a shorter course. I know two days can often be quite prohibitive for folks to take 2 days out of their life, but there's a 3.5 hour version of a suicidal alertness, which is often a nice place to step in called Safe Talk. But I'm really personally quite keen to build more connections with LGBTIQA trainers, with people in my community. Yeah, it is a bit of a conversation stopper, but talking about suicide is kind of the crux of all this. So yeah, I think it's a bit of a very practical stuff coming up, but also that bigger picture that I'm happy to be part of going forward.
Cool. Michelle, do you have anything to add? Closing remarks?
I think, yeah, a huge thank you to all of you, and also to sort of fabulous colleagues that I've worked with over the years in ASIST. Like there's so many people who have done great work, and particularly in working in Aboriginal and Torres Strait Islander communities as well. And some, yeah, and I guess a lot of the work that I've learnt in that space really is incredibly valued to working in our communities as well. But what is really obvious in amongst that is that we just need to mention, I guess, that at a policy level, we need some conversations about inequality and the impacts of inequality on suicide and suicidality. And I think that it's often a part of the missing link in terms of the conversation at a policy level. So if there's any policy heads out there at the moment, that'd be lovely if you can be thinking of how else to put that in there. I know it's not that it's not in there at all, but it's not a part of the big conversation. So, you know, that's important. And if any corporates want to sponsor a 2010 kind of workshop so that there can be loads of free workshops for community, then I think that's worthwhile contacting somebody. Don't you think? That's not, you know, given that I contract to 2010, so I can do the shameless self-promotion, I think, for 2010 on behalf of, I think that's always a nice thing.
That's amazing. Wouldn't be a webinar without some kind of shameless promo at the end.
Yeah.
I guess my kind of closing remarks are some things that I guess, like, I don't know how to make an invitation because I don't know what format it exists in, but it's the richness of this work has been in the relationships that I've had the fortune to build since kind of meeting a whole bunch of folk last year as we began this work, and also in the workshops that we've since run. And so I'm so hungry for more space to continue that kind of dialogue and that co-creation of knowledge, which we hold, you know, in kind of combination with all those other types of conversations around data and policy and advocacy. But I really, I thank everyone who's, I guess, come today, and wish I could see you and like spend many hours talking and sharing knowledge about what this kind of work means, but also offering debrief space with each other, because that's something that I've had some great conversations with folk around what it means to hold and synthesize the stories that we hear and hold of our communities, when one's authorized and trusted to be a holder, not always, you know, in a training space that does end for a moment. And so where are the next bits of our community to hold ourselves and each other? So I think so much more work to do. And of course also, like, how do we queer this even more? Like, how do we kind of queer it up? How do we challenge it? And where do we kind of, like Michelle said, here's where this model is great, but what else? What are the next things that we can kind of hold and share with each other? So really keen and curious to continue that learning, especially, I guess, in the context of where the systems don't support us, or where we have critiques or limits in how we engage with, I guess, mainstream kind of service delivery or emergency responders and those types of things. So definitely more to discuss. But I guess I want to also kind of, by closing, just do a shout out to all those, like Michelle said, that have kind of led this work or supported that knowledge to be where we are today, but also all the people in the room and elsewhere who have kind of done the work, like, you know, written the adaptation and organized the funding and kind of, allowed us to be here. So really thank you to those folk. So Charlie, you there? Do you want to?
I am.
You're there, cool.
Thank you so much. This has been such an amazing discussion, and I think you can see by the comments, the participants, you've left them wanting more, which is always a good sign. But I just really appreciate your vulnerability and using your personal self-reflection in such a public space. So thank you, all of you, for doing that. For those that have attended this webinar and will be watching online, it will be available online on our website. And I just encourage you to get in contact with your local LGBTI or get in contact with your local PHN. This work's happening all around the country, and it'd be good to find out what's happening in your area. And one thing did come up in the comments, which I'll just say out loud, is that some of this was done as part of PHN trial work for Black Dog Lifespan Model. And so all of this will be evaluated as well. So that, again, just creating that evidence base so we can reduce suicide. So thank you very much. I hope you have a wonderful afternoon. Thanks again to our beautiful presenters, and it'll be online soon.
It's 3 o'clock on the dot. That's amazing.
Thanks, everyone.